Bismillahirrahmanirrahim. We are talking about the Klinefelter syndrome. Klinefelter syndrome. Klinefelter syndrome. What is Klinefelter syndrome? The Klinefelter syndrome is defined as male hypogonadism that occur when there are two or more X chromosomes and one or more Y chromosome. The Klinefelter syndrome, there is two or more X chromosome. One or more Y chromosome. When there is two or more X chromosome or one or more Y chromosome, so this becomes, for example, there is two X chromosome, X, one or more chromosome, for example, one chromosome, XXY. This becomes 47 XXY. And when there is two or one or more Y chromosome and two or more than two X chromosomes at the same time. This is at the same time. If there is two chromosomes, the condition become like this. If there is two X chromosome and one Y chromosome, condition become like this, 47 XXY. If there is three X chromosome and one Y chromosome, three X chromosome and one Y chromosome, so condition become 48 XXY. This is called Klinefelter syndrome. The Klinefelter syndrome or Klinefelter syndrome is a type of hypogonadism. There is hypogonadism. Hypogonadism, in which two or more than two X chromosomes are present in the same individual, plus one or more than Y chromosome present in the individual, and the condition become like this, 47 XXY or 48 XXY. So the condition becomes like this. This also become like this, 47 XX 47 XXY and 48 XXXY or 47 XXY. So there is hypogonadism. Why these extra chromosome are present? This is the question. Why this extra chromosome are present? This is the question mark. Why? In normal individual it does not occur. So according to the Lian theory in 1961, the Lian hypothesis in 1961, it states that when there is two X chromosome, one become inactivated during the embryogenesis. This hypothesis states that when there are two X chromosome, one become inactivated during the embryogenesis. It states that the only one of the X chromosome are generally active, and the other X chromosome, for example, there are two X chromosome. This theory and hypothesis states that one X chromosome becomes inactivated. This theory for the X chromosome, that is when there is two X chromosome, ones become inactivated during the embryogenesis. It further states that other X chromosome of either maternal or paternal origin undergoes heterophynosis and is randomly inactive. One is become active and one becomes randomly inactivated during the embryogenesis. The inactivation of either the maternal or paternal chromosome occur at a random manner among all cells of the blastocysts, and this occurs about 5 to 5.5 embryonic life days. This occurs in the 5.5 days after the fertilization in the embryogenesis. After 5.5 days, the one X chromosome becomes, if there are two X chromosomes and the spermatogenesis occur in the two X chromosome, the one becomes active and one randomly inactivated. This theory is called Neon theory or Neon hypothesis. It states that either paternal or maternal chromosome inactivation occur. The inactivation of the same X chromosome persists in all the cells derived from each precursor cells. It states that inactivation occurs. But nowadays we know that there are two X chromosomes, for example, one become inactivated and one become active. This inactivated chromosome become reactivated. This chromosome becomes reactivated. This chromosome becomes reactivated. This reactivation occurs before the first meiotic division. This reactivation occurs before the first meiotic divisions. This reactivation occurs before the first meiotic division. And we also know that if there are two X chromosomes, one from paternal origin, other from maternal origin, some gene escapes from this X chromosome. They are become inactivated at the early embryogenesis, but some of these genes become escape. Some of these genes become escape from the inactivated X chromosome. From inactivated X chromosome. For example, the inactivated X chromosome are switched off, not. They are not switched off of gene, not switched off, not switched off of gene, not switched off. And some genes escape from the X chromosome that they are inactivated. The molecular study suggests that 21% of genes on the XP and smaller number on the XQ. 21% of the gene on the XP, 21% of genes, 21% of gene on the XP and a small amount, that is 3% on the XQ. They escape from the X chromosome that they are inactivated, and this escaped genes are involved for the deformities in the individuals. Normally this inactivated X chromosome becomes reactivated at first meiotic division, of which at first meiotic divisions of oogonia. At first meiotic division of oogonia. In the oogonia, when there is meiotic division occur before the first meiotic division in the oogonia, this inactivated X chromosome becomes reactivated before the first meiotic division of oogonia. This is the case when there are two X chromosomes. Now we discussed about the Klinefelter syndrome. Klinefelter syndrome is a type of syndrome in which there are more than two X chromosomes. There are more than two X chromosomes, and at the same time there are more than one Y chromosome, one or more than one Y chromosome, two or more than two X chromosome at the same time, and represents with the hypogonadism. Hypogonadism. The Klinefelter syndrome is the most common cause of hypogonadism in the male. Is the most common cause of the hypogonadism. Hypogonadism in male. Hypogonadism in male. So in the Klinefelter syndrome, there is hypogonadism in the male occur. The Klinefelter syndrome occurs rarely be diagnosed before puberty. The Klinefelter syndrome rarely diagnosed before puberty. They rarely diagnosed before puberty. In this Klinefelter syndrome occur 1 in out of 660 live births male. This occur 1 in out of 660 live male births. This is 1 in out of 660 live births in male, but they are rarely diagnosed before puberty. At the time of puberty they are diagnosed because there is testicular abnormality. Before the puberty, testicular abnormalities are not developed. At the time of the puberty they are diagnosed. The Klinefelter syndrome is diagnosed at the time of the puberty. Before the time of puberty, this is not diagnosed because the testicular abnormalities are not present. Testicular abnormalities are not present before puberty. At the time of puberty, there is testicular abnormalities appears that predispose the diagnosis to Klinefelter syndrome. Most patients have a distinctive body habitus with increase in length between the sole and the pubic bones, that is long legs. Now we discuss the features of the Klinefelter syndrome. In the Klinefelter syndrome, most patient develops and represent as a feature of distinctive body habitus with increase in length between the sole and the pubic bone, that is increased length between the sole and pubic bone, that is called long legs. Klinefelter syndrome called long leg person, long legs. So the patient of the Klinefelter syndrome present is a long patient. Its length is more than the normal individual. They represent with distinctive body habitus with increase in the length between the soles and the pubic bones, that is elongated body and long legs. And the atrophy is also associated with a small penis. There is testicular atrophy. In the Klinefelter syndrome, there is testicular atrophy. There is testicular atrophy. The testicular atrophy and small penis. Small penis of the patient, testicular atrophy, predisposed to diagnose the Klinefelter syndrome. The atrophic testes often associated with small penis in the late secondary male characteristic. There is lack of secondary male sexual characteristic or sexual characteristics. They lack the secondary male characteristics, and they present with gynecomastia. They present with gynecomastia and lack of secondary male sexual characteristics. The secondary male sexual characteristic they lack in the Klinefelter syndrome example is beard. They lack beard in male distribution of pubic hair. They lack beard. and lack the pubic hair distribution, and they lack these conditions. That is, they lack the beard hair and pubic hair distributions. The mental retardation is uncommon. In the Down syndrome, the mental retardation occurs. Down syndrome is the most common cause of the chromosomal anomaly of mental retardation. But in the Klinefelter syndrome, the mental retardation is uncommon. Mental retardation is uncommon. The patient with the Down syndrome develop premature Alzheimer's disease before the age of 40. But in the Klinefelter syndromes, the patients develop type 2 diabetes. Type 2 diabetes mellitus. Type 2 diabetes. In the Down syndrome, the patient develops severe cardiovascular diseases in 40% of the Down syndrome, and they present ostium premium, atrial septal defect, ventricular septal defects, and other defects. While in the Klinefelter syndromes, they present mitral valve prolapse, seen in about 50% of the patient. They present in the Klinefelter syndrome, they present mitral valve prolapse. Mitral valve prolapse occur in 50% of cases of the Klinefelter syndromes. So, how will we investigate? We investigate the plasma gonadotropin concentration. Plasma gonadotropin concentration. And we also investigate for follicular stimulating hormone, that is FSH. Investigate for FSH. We also investigate the testosterone level. And we also investigate the mean plasma estradiol levels. Mean plasma estradiol level. The mean plasma estradiol levels are elevated. Mean plasma estradiol levels are elevated in the Klinefelter syndromes. The follicle stimulating hormones are elevated in the Klinefelter syndromes. The testosterone level are reduced in the Klinefelter syndrome. The testosterone level are reduced in the Klinefelter syndrome. So, Klinefelter syndrome is an important genetic cause of reduced spermatogenesis in male infertility. There is reduced spermatogenesis in the Klinefelter syndrome. The Klinefelter syndrome is an important cause of male sterility. Because there is reduced the spermatogenesis. There is reduced the spermatogenesis. In some patients, the testicular tubules are totally atrophied. The testicular tubules in some patients are totally atrophied. This testicular tubule in some patients is totally atrophied. This testicular tubule is totally atrophied in the Klinefelter syndrome. And this atrophied testicular tubule in the Klinefelter syndrome is replaced by the pink hyaline collagenous ghosts. And this is replaced by pink hyalinized ghost. There is total testicular tube atrophy. Patient with Klinefelter syndrome has the higher risk of breast cancer, 20 times more than in the normal populations. And they may be predisposed to autoimmune disease, example SLE. Patient with Klinefelter syndrome have a higher risk for breast cancer. This patient have higher risk for breast cancer, 20 times more than the normal individuals, and they have may be predisposed for autoimmune disease, example systemic lupus erythematosus. They predisposed to SLE.